So the topic for today, grief and the new year, and really focusing on transitions and trying to cope with that yourself, and in relation to grief and your own journey with your grief at the moment. So, um, sorry, that just was frozen there for a second. So really when we're talking about transitions in the new year, and the reason for kind of bringing this topic up really is because grief itself is such a process. It's such a transition. It's such a new way of learning to be in the world. And often when there are other changes and other transitions happening around us, it can pull on those threads, especially when you're already living with loss. So that's really the sense around having a focus on this topic this morning. And while death can happen itself, like in a moment, an actual death, an event itself, grieving being very much a process. And we're just going to give some space to kind of talk through that process before then we look at maybe some things that might support coping at this time, and especially at this time of year. So the holidays themselves, people can have very mixed feelings around it, very mixed reactions. Sometimes people can really struggle with the expectations of how they're supposed to be over the holidays, over the Christmas, over the New Year, and sometimes can feel more alone or struggle more in their loss and in their grief when it might appear that others are all very happy and are connected and spending time with people that they love. So by its very nature itself, sometimes the holidays and the Christmas can really bring up a lot for people really in that. Then with the kind of coming of the new year, it really can be a time of reflection, where people might start looking to the past, start looking to the future. And those things in themselves are not necessarily bad things, but when you are grieving and when you're in the middle of your grief, trying to cope with your loss, sometimes going back to the past and going to the future a lot can be very overwhelming. It can be very jarring. It can bring up an awful lot. Often people find in grief that trying to cope in the present moment and trying to cope in the day to day can serve them well. So with there being an awful lot of focus on going to the past and going to the future, it can bring up an awful lot for people in relation to grief. Sometimes like that with the turn of a new calendar year, it can make it feel as though the previous year is moving further into the past, or maybe if it was last year that the person that you loved had died, that it can feel very hard to turn into a new year, facing into a new year. It can feel very daunting, very frightening, without that person being present for that. And with life having changed so much in relation to trying to cope with loss, in relation to trying to grieve, further change and further newness, I suppose, can really just bring up an awful lot for people. So it's trying to really watch your expectations of yourself. Try not to get pulled into expecting yourself to be a certain way because the date has changed. Because in lots of ways, it's not to say that it in any way lines up with where you were at in your grief. The calendar might have changed, the turn of the year might have come, but nonetheless, you're still in your own process in that, in trying to cope. And so it's not about trying to move on or trying to expect yourself to be different now because it's January. It's trying to go on. It's trying to think of how to support yourself and how to support yourself with this new change of the new year, as well as what you're already dealing with. So generally speaking, it's trying to watch how much you're pulled into going to the past and going to the future. It's very normal that we'd have thoughts that this time last year or this time so many years ago, what you might have been doing or what might have been coming up. And it can bring a lot of emotions flooding in. So really watching your expectations around yourself in relation to that. Grief by itself, it is a loss, it is a change, it's a transition. It's trying to learn to be in the world without that person being present, trying to live in their absence, I suppose, rather than in their presence. And further changes are expecting an awful lot from yourself with the turn of the new year can be overwhelming. So we can really try to resist that change, like especially in relation to grief when it does happen or in relation to loss. Our nature is to try to resist that change. Complete disbelief that it's even happened, not even wanting to take it on board that it's real. It's a very natural kind of reaction to a loss initially. So sometimes people can very much feel like they don't want the new year to change. They don't want it to move forward or to move into a new year without the person they love. And even though the date might have changed and it might have moved, it's okay if that doesn't hold any significance for you in that. It's okay that you still continue on your journey with where you are at, and that you will be carrying that person with you, the person that you love with you, even though we're talking about a new year, we're talking about change, further change. What can be very unhelpful for people is when there's a lot of pressure to be a certain way, a lot of expectations on yourself to now be different or to be at a certain point because it's the turn of a new year. Um, in a sense, really, it's not to say that the turn of a new year really lines up at all with where you're at in your grieving process. So, really watching the expectations of yourself. I mean, it might feel quite arbitrary, really, that the date has changed when you yourself are on your own journey that needs to take its own course. They can't be sped up or rushed because the turn of a date. So it's very much trying to give yourself permission to be where you are, to take your grieving at your own pace, and not to feel pulled into the expectations or pressures to be a certain way. You know better than anybody else how you're feeling and where you're at in this, and trying to listen to that and take care of that and give yourself what you need. But people can be very individual with how they react to like that a new year or to new changes or new transitions in life. Some people might feel hopeful about it. They might, have certain things that they are looking forward to while alongside, their grief being ongoing, or they might have certain things that they want to achieve or certain things that they would like for the coming year. Others can feel very daunted by it, really want to kind of push back against it, feeling very overwhelmed about the idea of a whole year sort of stretching out in front of them. Um, some people then might feel really ambivalent about it at all. They might give it very little focus or meaning because it really might just not hold any relevance for them. And then others can have a mixture of feelings. So again, it's trying to watch the expectations of yourself that you might feel different, and different to other people, and that's okay too. Like that, even the people who are attending this morning, I appreciate that for some people it might be a partner, it might be a parent, it might be a sibling, a friend, another family member. The loss might have been very recent, it might have been very sudden, it might have been some time ago, and it might have been after a long illness. So the nature of it is that people will have their own individual reactions to their grief and also to then further transitions and changes. So it's really trying to be kind to yourself about it, trying to learn to be in the world without a person that we love, but trying to live in their absence. It is a huge learning and adjustment process, as well as the painful emotions of trying to grieve for that person. Um, so really trying to watch what extra changes and expectations you're loading onto yourself and whether they feel that it is the right fit for you or it is the right time to be considering that, because it has to be at your own pace. There's no rules for how you should be or where you should be at a particular time in your grief. It very much is like an emotional roller coaster where emotions will change, where feelings will kind of come and go. But gradually, for most people, they do find an equilibrium again. They do find that their grief becomes more manageable. But the course of that and the timing of that is going to be very individual for each person who's going through that. So it's not a process, that we can speed up or go around. It is one that we need to go through. And so, really, with the focus of today and with the discussion we'll have afterwards, it's just watching where that sits with you now at this time of the year, watching what expectations you have, watching what you're hearing from yourself, or feeling that you're supposed to be a particular way, because generally that is quite unhelpful. Anything that is very restrictive or very fixed, expecting yourself to be a certain way, generally is quite unhelpful. It's more helpful for us when we're psychologically flexible and can allow ourselves to be where we're at and trying to take care of that, at this time. So when we're thinking about grief, I suppose it's important to actually put some context around it, that when we're talking about models of grief, really there are different models and different theories around it, but probably the most commonly understood and the most common sort of understanding around grief is that it's a dual process model. So that there are two aspects going on simultaneously. One being the loss oriented aspect, that's the actual work of grieving, the memories, the trying to process the painful emotions that come with that, the trying to make sense of it, the denying it at times, the trying to actually process and feel the loss. And then on the other hand, there's the restoration, aspect of it. That's the actual attending to life changes. It's the doing the new things. It's the getting up each day, excuse me, and doing the things that you need to do. It's the actual functioning. It might be having a new conversation, reading a new book, going on a trip, or doing the day-to-day things. It's a necessary distraction from grief. I suppose when you think about it, really, both processes need to be happening, because if we were entirely focused on the loss, on the grief 24/7, we wouldn't be able to function, to get up, to do anything, because it would just consume all of life. And by the same token, if we're focused entirely on the other aspects of life, then we're probably not really processing the loss. So the model really says that you're trying to live in two worlds at once. It's the back and forth and back and forth and back and forth, over and back between actually the work of grieving and needing the break from it as well. And sometimes people find it very hard because they might find that they do something that they enjoy, or they find themselves laughing at something and think, how could I be doing that when I'm trying to grieve? And yet it's necessary, because it just isn't possible for us to 24/7 be in that grief. So generally what happens is people move back and forth and back and forth and back and forth between these two aspects until they kind of find a new equilibrium again. But sometimes, like that, with the holidays, with the new year, with this kind of more wider social influences, we may be for a period pulled more so over into the loss orientated aspect, especially at this time of year. Um, so it's trying to learn how to hold both, and it's needing to give yourself permission to have space in both as well, to do the work of grieving and also to have a break from it as well. So just to consider then some things that might support coping just around this time and with what's going on sort of wider socially at the moment. It's trying to give yourself permission to be as you are, really watching what you're hearing from yourself, um, avoiding expectations to be a certain way. You're really trying to ask yourself, is what you're hearing from yourself supportive or realistic? Is it kind? Is it helpful? And if it's not, to really just maybe sort of question that just for yourself, trying to come up with something that is fair, that is kinder, that is supportive for you. Considering your general self-care, trying to take care of the basics like rest, sleep, your diet, movement or exercise, the support that you might be connected to, or connecting with others, or activities that are meaningful and that are helpful and supportive for you. Trying to allow yourself to feel your emotions as they are. And generally, emotions do come in as waves, and they do peak and then they do pass again. But trying to permit them to move and to allow yourself to feel them as they pass through as well. Again, probably in relation to self-compassion, it's similar to thinking of, how are you talking to yourself? What are you hearing from yourself? Is there kindness there for yourself with how maybe the last few weeks or months has been, with all of the holidays, with all of the celebrations going on, and how you have managed with that? And it's okay to say to other people how you are feeling, that maybe being honest with people, saying, this is where I'm at, and I'm not interested in the year, and I'm not thinking about, a particular aspect, if that's where you are, and that's okay too. Try to watch your social media use, if you're finding that it's making you feel worse, if you feel that it's unhelpful, if you're seeing images of idealistic lifestyles, or the snippets that we do see of other people's lives, just trying to watch it. And if you're finding that it's not helpful for you, maybe trying to pull back from that as well. Watching your drug or alcohol use, especially around this time of year, can be in abundance really around alcohol, which a lot of celebrations, and that's fine, but just watching your own alcohol use in relation to how you're managing. And if you feel that you're using alcohol as a means of coping, maybe just kind of questioning that, or maybe seeking further support if you feel it's becoming problematic for you. And it might be thinking going forward, how you did cope with this holiday season, how you did cope with the turn of the new year, and how you might want to deal with anniversaries or important dates going forward. Are there particular ways you do want to remember the person that you're grieving, and how you might incorporate those things going forward as well? So instead of maybe pressures or expectations, you're very much trying to move to a more supportive self-talk. Instead of loading yourself with more things that you're meant to be doing, it might be thinking, well, actually, could I try to be kinder to myself this year? But when I do find, oh, sorry, that person could just leave, please, if you don't mind. Thank you. Could I come back to the present if my mind is wandering to anxious thoughts? You're trying to create that very supportive self-talk for yourself, So instead of loading yourself with a lot of new things to do, it might be thinking, is there a way to take care of myself, to be kinder to myself, and to support myself into the new year? Sometimes people do find that with the turn of the year, it helps them to kind of recognize that somehow they have coped, somehow they have gotten through the last few weeks, that somehow their grief is changing, even though it is still difficult. It can maybe prompt sometimes people to reflect that actually it is different to maybe initially when you first um, experienced the loss of the loved one. So it can sort of prompt it too that even though your grieving process is ongoing, it can sometimes actually help people recognize that some part of them is coping, even though it is very, very difficult. Um, Sometimes around the time of year like this, sometimes people can feel very supportive with others in their life and feel very appreciative of the kindness they've received. And other times they might struggle with maybe feeling hurt with how helpful or available they have found others to be around this time, especially if they feel misunderstood or that their grief hasn't been acknowledged. So that can be difficult as well, sometimes for people to cope with. But it's really trying to talk with and connect with people who do understand, whether that's individually in a group like this, um, or else maybe considering seeking counselling or further input from your GP if you do feel that you're really struggling to cope. But more than anything, not trying to be on your own with it, that there are ways to try to navigate this and not to be on your own, because there certainly is support there here at the service and other services as well. Um, so with that, we'll just finish up and I will just stop the recording here and we're going to have space for questions and for discussion. So thank you.